Today we are going to discuss about the infant positioning assessment tool that is commonly known as IPAT, and this tool is mainly used in NICUs to evaluate the posture, the positioning of the preterm infants. So before coming directly onto this tool, this picture, I would like to give you a brief idea about what actually is IPAT and how do we uh, assess the position using this chart. So first of all, let us have a quick look. This infant positioning assessment tool, also known as IPAT, is the pictorial tool that is used to assess or to evaluate the posture of the preterm infants. So for the assessment of the position in the premature infants using this IPAT tool, we consider mainly 6 areas, and those 6 areas are head, neck, shoulders, hands, hips or pelvis, and knees, ankles and feet. So these are the 6 areas where we have to assess the position, and the scoring that is given is from 0 to 2. So you can give 3 scores, that is 0 or 1 or 2 in each area. So that will become a total of 12 scores. So the highest score, the best score that you can give is 12, and the lowest score is 0. So the range of the score is from 0 to 12. And now, when do you have to give 0, when you have to give 1, and when you have to give 2. So while assessing each area, if you find that the position of the baby is ideal, then you have to give score 2. And if you think that the position is acceptable, it is neither good nor bad, then you can give 1. And if you think that the position is very bad or unacceptable, then you have to give the score 0. So when you give the score in all these areas from 0 to 2, then you will get a total score. So if the total score that you get is 12, it means it is the full score. So that will be the best score that you have achieved. Then you can also get the score if the range is from 9 to 11, then it is acceptable score. So acceptable score in most of the cases is because of some external factors as well. Like if in the hand you see the cannula is present, or any line such as PICC line is present, or near the abdomen or on the neck any drain is present. So in that case the score can change. Like the baby is of the capability of maintaining the ideal positioning, but because of these external factors the position is slightly changed, then it comes under acceptable position. And if you get the score that is less than 8, it means that there is need for positioning support. So what actually is positioning support? If you have visited an ICU, or if you are a student or a healthcare worker working in the NICU, then you must have seen that all the preterm babies or even the term babies, all the babies are kept under a structure, a nesting. This is known as nesting. They are kept under this nesting, supported with head roll or shoulder roll, and you must have also seen these supports near the head of the baby. So all these things are there to maintain the proper positioning of the baby. The shoulder roll is given to maintain the position of the shoulders. The head roll is given to maintain the position of the head. And this nesting is there to provide warmth to the patient, to provide comfort to the baby. All these settings, this nesting mainly is given to mimic the in utero environment. Like, since the baby is very small, in most of the cases the preterms are there, they have come out of the womb a lot earlier than their expected time was. So they need that environment, that in utero environment, that soothing environment, that comforting environment outside also. So to provide that kind of environment, we are providing all these comfort devices to the babies. So now what is the goal of doing this IPAT scoring? Why do we need to do this IPAT scoring? This is done to provide developmentally supportive care to the baby. If you do not assess that what is the position of the baby, you will not be able to judge whether the baby needs any kind of supportive care or not. So this IPAT scoring, whenever any preterm baby comes in the NICU, the first thing or the one of the first things after settling the baby, after making the respiration and the airway, the breathing, all this, after maintaining this, we come to the supportive care of the baby. And then this is done to provide comfort, to provide them with proper sleep, self-regulation, and sensory system development and growth. So this scoring helps us to maintain the proper positioning, thereby maintaining the comfort of the baby. Now coming on to the tool. This is the chart that we use for assessing the position, for giving the scores. So here you can see the scoring is given. This is 0, then we have 1, and we have 2. So the first area which we are going to assess is the head. So in this picture you can see that the head is rotated laterally. This is more than 45 degrees from the midline. So in this case, this is the most unacceptable position you can find the baby in. So in this case, you are going to give the score 0. Then we come to the next position. In this, the head is neither in the midline nor totally tilted laterally. So the degree of deflection of the head is 30 to 45 degrees. So in this case, you can give the score 1. And here you can see the head is aligned left or right 0 to 30 degrees from the midline. So in this case, the rate of the degree of tilt of the head is from 0 to 30 degrees. In this case, you have to give the score 2. So this is the most acceptable position of the head you should keep the baby in. And to keep the baby in this position, because the baby is infant, the baby is a preterm, he will not be able to maintain the position of the head on his own. So to maintain this position, we use head rolls on both the sides of the head so that the alignment of the head of the baby can be maintained. Then next, coming on to the neck. Here, when will you give 0 score? When the neck is in hyperextension or hyperflexion. Here you can see the neck is hyperextended, or if the neck is hyperflexed towards the body, towards the midline, then also you have to give 0 scoring. And when the neck is in neutral position, you can find here that the neck is neither extended nor flexed. It is in the neutral position. Then you have to give the score 1. And then when can you give the perfect score? That is the score 2. When the neck is neutrally aligned, head slightly flexed forward up to 10 degrees. So here you can see that the neck is in the neutral position with the body and the head is slightly flexed up to 10 degrees. Then in this case, this is said to be the perfect position and you can give the score 2. Then the third part is the shoulders. Here you can see that the shoulders are retracted. Here this part, if you focus here, the retraction can be seen in the shoulders. So this is the most unacceptable position. So you have to give the score 0. And for 1, you have to see that the shoulders are aligned flat to the surface. Here the retraction is not present, but they are not rounded. They are aligned flat to the surface. In this case, you have to give the score 1. And for score 2, you should see that the shoulders are rounded forward towards the midline. So this is the ideal position of the preterm, that the shoulders should be rounded forward towards the midline. Then the next part is the hands. So in the first picture, you can see that the hands are away from the body. So in this case, you have to give the score 0. Then the hands are touching the torso. The hands are touching the chest or the abdominal area. So in this case, you can give score 1. And here you can see that the hands are touching the face. Many a times if you visit an ICU and if it is a healthy baby, it is a baby without any kind of without any intubation, without any support, in most of the times in healthy preterms you will see that they are lying like this. Both the hands are on their cheek, are touching their face, and that looks even cute. So in this case you can give this score 2. So this is the ideal position of the hands, where the hands should be placed. Then coming on to the next part, we have the hips and the pelvis. Here you can see that the hips and the pelvis are abducted, externally rotated. First, you must know that what is abduction and what is adduction. If this we consider as the midline, this is the midline of the body, and the hips here are away from the body. So this is known as abduction. Okay, so the hips you can see they are abducted. Here you can focus, these are abducted hips and are externally rotated. The hips and the pelvis is externally rotated. So in this case you will give the score 0. Here you will see that the hips and the pelvis are aligned but extended. The hips are not externally rotated, neither they are internally rotated. They are aligned with the midline, but they are extended. There is no flexion. And now here you can see that the hips and the pelvis are aligned with the midline. This area you have to focus. They are aligned with the midline and are softly flexed. The flexion can be seen here. They are softly flexed towards the body. This is the perfect score. This is the perfect position, and you have to give the score 2 here. Then we come on to the next part, that is the knees, ankles and the feet. In this case, the knees are extended, ankles and the feet are externally rotated. So this is the most inappropriate position. You have to give the score 0 here. And then the knees, ankles and the feet are aligned but extended. Here also, since you can see here they are externally rotated, but here the ankles, feet and the knees all are aligned in one line, but they are extended. So this is acceptable position but not the ideal one. So here you have to give the score 1. And then in this case you will see that the knees, ankles and the feet are aligned and softly flexed. So this soft flexion of the hips and the knees, ankles and the feet is the ideal position of the infant. So I think that you have understood the IPAT scoring. You just have to keep these things in the mind. The 2-point scores. This is the ideal position of the baby. If you have some degree of deflection from this ideal position, then you can give the score 1. And if the baby is in totally unacceptable position, then you have to give the score 0. So while practicing it on actual preterm babies, you will be able to memorize it easily. So this is the chart that we use for the reference when we do the IPAT scoring. I hope IPAT scoring is clear, and any questions are welcomed. Thank you.